Hello, everyone. Today is March 10th of 2022, and I'm here with Matt Boyce. And Matt, I'm actually going to turn this over to you to introduce yourself and tell us about your background, your education, and your job at the center.
Sure. Thanks, Emily. And thanks for this opportunity to, I guess, talk a little bit about, where I've come from and the work that I've done. So I joined at the center in 2017 after completing a master's in global health at Duke with the concentration in policy and infectious disease. Really kind of was thrown on a wide variety of projects at the center. And I guess one of the reasons that I was drawn to it, I think a good way to characterize what I was doing was just a little bit like a Swiss Army knife, where they, speaking candidly, there were a lot of, before COVID, there were a handful of key actors kind of working in the pandemic preparedness and response space. But obviously there was broad consensus in the community that, okay, it was important to be preparing should a pandemic or a large scale epidemic arise, but nobody actually knew what exactly that was going to be. We had our guesses, just based on previous experiences and knowing the different types of pathogens at the rate that they evolve and emerge, so on and so forth. But, nobody really knew exactly what to be preparing for. They were just trying to do what we thought, was a best practice, and something that could cover, I guess, the broad spectrum of different possibilities. So, that was kind of like the work I was working on at the time. A lot of it was related to, creating data sets about the various assessments that were going on to measure preparedness or response capabilities, tracking funding, seeing, what governments or entities were funding different aspects of preparedness and where in the world those were being funded and prioritized. I think those were probably the two broad overarching things. And then there were a number of other projects I could talk about if you want me to. I guess I'll stop talking there though for now.
Yeah, wonderful. So then kind of specifically looking back to what you were doing in December 2019, how did your work and maybe your role at the center at all shift given the spread of COVID-19 in the spring of 2020?
Yeah. So that one, that's an interesting question. Thinking back to December 2019, I'm trying to think about what the big projects I was working. So I was working, Dr. Rebecca Katz and I were working a lot with mayors, specifically, and a network called the Global Parliament of Mayors, to try to advocate for pandemic preparedness in their cities. And at the time, it seems kind of trivial now, but at the time, what we were really focusing on was measles and waning immunizations for measles and vaccine hesitancy, because in late 2019, that was kind of a hot topic, if you will. And I was working on also co-editing a volume with Dr. Katz about various models of pandemic preparedness that were being used in cities around the world. And then there was a separate project where we were looking at the Global Fund to fight AIDS, TB, and malaria, and kind of looking at their budgets and what they had been spending on and how that could potentially, if a pandemic happened, how those investments could support pandemic preparedness and response. And so that was December. And so then when COVID emerges as kind of a global priority, or I guess, didn't really emerge, it kind of kicked the door down. Everything I would say like the focus of the projects themselves kind of stayed the same, but the focus just shifted to COVID. So rather than talking to mayors about measles and vaccine hesitancy, I guess the vaccine hesitancy bit stayed, but measles was replaced by COVID. The book, we we kind of sent instructions out to authors saying, okay, let's talk about what you were doing. There will be another opportunity in the future to discuss what you're doing about COVID, which that effort's now underway. And then the Global Fund, kind of same thing. That work was, it had a very defined time frame that it was looking at, but the urgency of the work and talking about how this organization has been putting money in training healthcare workers, and about this much. Here's how they can pivot or could support the response to COVID. So everything kind of went from like the more theoretical to more practical and applied, I would say. It was, and then in addition to all those ongoing projects, there was just kind of this spirit of all hands on deck, I would say, when COVID emerged.
Yeah, that's so interesting to hear. And then, just kind of looking back now on the last 2 years, this is your opportunity to talk more about any of those projects you mentioned, or any of your work you've done at the center kind of since 2020.
Yeah. So, thinking specifically about the work at the center and the COVID work at the center, I think the one project that I was probably the most engaged with happened early on in the pandemic, partly because I left as a staff member to go back to school to do my Ph.D. in the urban work. But the project I was most involved with was a project called COVID Local. And thinking back on this project, it was a really cool project. We got to work with a lot of great people, Nuclear Threat Initiative, Center for Global Development, Thales Analytics. So brought in some really smart people, but what we were working on was trying to develop practical guidance for the mayors and the county health officers, and really the people who were boots on the ground trying to actually respond to the pandemic, especially at the beginning, were kind of functioning in the absence of any real guidance from the federal level, which there was so much movement, and it was such a dynamic situation that I can understand to an extent why there wasn't guidance. We didn't really know what we were doing and dealing with at the time. But that doesn't excuse, when everybody's looking to the CDC, for example, for, okay, what, help us out here. What are we supposed to be doing? And the CDC kind of says, yeah, we don't know yet. That's not super helpful to somebody that, is seeing their hospitals fill up with people with a disease. So what we tried to do was create a decision support framework to help local leaders, I guess, think through what needed to be done to reduce the impact of the pandemic early on. And then also how to safely reopen once the discussion shifted from shutting everything down to opening everything back up. So we kind of created a tiered framework for doing that. And, I think that effort it was really cool to be involved in that effort. It was one of those where you would have meetings with local authorities and officials, and you could sense the urgency with which they just wanted any sort of guidance, even if they knew it wasn't perfect, or even if they knew, okay, this might change in 2 weeks because we're learning more about this new disease every single day. Like, just tell us what your best guess is right now, because we're kind of, we're operating in the dark here. And so it was a humbling experience, one of those where you kind of constantly had to say, based on the limited data we have right now, this is what we think is the best. And were we always right? No, but I think more often than not, we were operating from a place of, if we were in your shoes, this is what we would do, and here's the rationale for why we would do this. And now, it's funny reflecting on that. I guess almost 2 years later, we know so much more about this virus and how it spreads and who it affects. And, that project had a time and place, and, whenever the next big scary pathogen emerges, I'm sure, something similar will need to be stood up. But, right now, I feel like the utility of that project is not as great as it was at one point, just because we know so much more now. But in addition to that effort, I think another thing that everybody at the center did, and myself included, was there was just everybody in the media wanted to talk to somebody that knew something about infectious diseases or health security or pandemic preparedness and response policy. And it got, so, talking to the media, and, whether it was making appearances on television or talking to journalists who were writing articles. I mean, I remember talking to a journalist about, okay, so all the restaurants are shutting down. What does this mean for delivery workers? Are they at increased rate? It was like a super obscure article and an idea, but an important one. And so, yeah, just taking media appearances, and putting the necessary caveats in where they should be, which is something I think I know myself, and I think other people at the center did a pretty good job with that. I know there were lots of people who will just say, suddenly we're experts, and making broad sweeping generalizations about things that maybe they knew something about, but didn't necessarily know a lot about. And it's one of those things where, okay, yeah, it's a new disease. Nobody can know everything about it. But, I do think that, making a pivot from when you're working in the space and you have a kind of general idea and you've been more tuned in, like, it's easier to make that shift than, say, if you're working on non-communicable diseases. Yeah, you're working in public health. But, maybe there are others who have a bit of a more nuanced understanding about what exactly is happening right now, and know a little bit better about, what are some of the disclaimers that need to be put in place. And I really think that moving forward, if there's one, in my opinion, if there's one lesson that really needs to be, I think, learned from this whole experience the past 2 years, it really, a lot of it has to do with communication and risk communication, and how experts communicate with policymakers, how they communicate with the media, how they communicate with each other, how they talk about what they know, what they don't know. And then, yeah, social media is a whole different beast that I will not get up on that soapbox. But yeah, I think I'll stop talking there.
Yeah, no, that was all so interesting to hear about. And you mentioned now you're in the middle of a PhD, correct? And I didn't know if you wanted to talk more about thinking ahead, what comes next for you, and what do you think these next 6 months will look like, and any current work you're involved with that you want to share, or anything else.
Yeah, sure. So perhaps unsurprisingly, hearing about what I was working on before the pandemic and then early on in the pandemic, my research and work is mostly focusing on what is happening at the local level. And I think that this is an important area to research. There's been a lot of focus on global health security and national level pandemic preparedness and response. But, as I alluded to earlier, really it's at the local level where the rubber hits the road. And I feel that, at least in the recent past, these local level actors and authorities have been relatively neglected. And I think that is an area, just from a practical standpoint, where preparedness could really be improved. Knowing, what resources exist at the local level and how to best foster local level preparedness. You conduct these, for example, the Joint External Evaluation Assessment. You conduct these assessments. What does it mean that lab capacity is a 4 or a 5 nationally? Is that a helpful, I guess, scope to be looking at things? Or would it be better if you could drill down another layer or two and be able to say, sure, Baltimore, Maryland has a great lab, but elsewhere in the state of Maryland, yeah, no, you don't have diagnostic labs, or you don't have this capacity. You don't have this many hospital beds. Because I think there are a lot of implications for that. Just continuing to use the Maryland example. If everybody knows that all of the hospital beds are in the big cities, well, okay, when they get sick, people in rural areas are going to flock to the big cities. And we've seen this throughout the pandemic. Bangalore, India is actually or Bengaluru, as it's called now, is a really interesting example of this, where, everybody in the state that it's located in knows that that's where the best healthcare capacity is and was. And so then when they got sick, they've, flocked to the city to try to seek care, very understandably so. But then it completely overwhelmed the systems there. So that's really where I want to go moving forward, is focusing on how, I guess, documenting what happened at the local level, specifically in cities, and then trying to identify ways to make sure that that it never happens again. What needs. I'm not ignorant enough to say that this is, going to be the last pandemic. There will be another, very unfortunately, possibly in the near future. But I do think that there are steps that can be taken to make sure that we aren't caught off guard in the way that we were for this one. And to me, at least, I think a lot of that has to do with the local level. So, whether it's changing the scope of those assessments or just, mapping different governance models so cities can better share lessons between each other and know, like, okay, I've got this authority and so does London. Say Baltimore, we'll keep using Baltimore as an example. Baltimore and London each share this authority. Can they share, lessons between the two in a way that might be more appropriate compared to, like, if they didn't have that same authority. And yeah, I think that's where I would like to go. I mean, there's no shortage of work to be done, unfortunately. And I think, the world at a certain point is going to need to recognize that it needs to move on from COVID, and recognize that you don't want to over prepare for COVID 2.0, because there's a good chance the next pandemic it may not be a respiratory disease. It could be something completely different. Or even if it is, it might be completely different than COVID. So you don't want to overcorrect and over prepare for COVID. But, recognizing that there are things that we need to learn from this experience. And if we don't, the opportunity to a certain extent, I think will have been squandered if we don't come out of this experience more prepared for the next pandemic.
Yes, well, thank you so much for your time today, Matt. Your work is so incredibly important, and it's so interesting to hear about all your contributions and your perspective on that, and really appreciate you taking time to share your story.
Yeah,